Since my career began in 2006, I've seen the switch from the use of cytotoxic chemotherapy agents, such as FCR and BR, to the use of targeted novel agents such as ibrutinib, venetoclax, and most recently acalabrutinib. Patients are tolerating these therapies better and they're living longer on them. I manage the care of patients diagnosed with CLL who are both on observation and on therapies, including clinical trials. I'm able to diagnose and treat conditions. A huge part of my role as an APP is patient education, helping patients understand the disease process and help treat side effects related to the disease and therapies that they're undergoing. Regimens most frequently used in the frontline setting where patients diagnosed with CLL include ibrutinib monotherapy, venetoclax obinutuzumab following CLL14, and most recently acalabrutinib is available to be used in the frontline setting. Patients who are relapsed or refractory, the treatment options depend on what they've previously been treated with. If they've seen a chemotherapy regimen such as BR or FCR, we have the option of using ibrutinib monotherapy and venetoclax plus or minus a monoclonal antibody. The RESIDent-3 trial compares the use of ibrutinib to ofatumumab in patients diagnosed with CLL in the relapsed refractory setting. The trial basically showed that that ibrutinib is far superior to ofatumumab, and that with prolonged therapy, patients were able to achieve a deep and durable response on ibrutinib. However, there is a small population of patients on ibrutinib that were intolerant and actually had to come off drug. In addition to venetoclax and ibrutinib, you also have the option of using a PI3K inhibitor such as idelalisib or duvelisib as well. In the past, we've referred our patients to the Leukemia Lymphoma Society. They have been really helpful with both patient education and financial assistance. In addition, our pharmacy staff has access to a lot of individualized patient assistance programs which can help mitigate the costs with ibrutinib therapy. So they've been really helpful as well in the past. The UNI program can be utilized once ibrutinib is prescribed. It'll help the patients understand their insurance coverage, potential out-of-pocket cost, and help utilize potential copay assistance programs that may help mitigate the cost. The UNI program will actually reach out to your insurance company to help you better understand your coverage and see if you're eligible for those copay assistance programs.